All right, so we're joined by the athletic trainer for the Department of Dance at Belhaven University here in Jackson, Victoria Fauntroy, who also is from the DMV, Fairfax, Virginia, and she'll tell us about going to George Mason University. We're in the Health Science Career Cluster, and we are recording this for all of our friends at Ridgeland High School, Germantown High School, Rosa Scott, the Academic Options Center, and for our YouTube channel. And I've got a room full here with me at Velma Jackson. So before we get into what you're doing, we just looked at some things about the health science careers and about athletic training. And you're in the new and growing field of dance science, which is I had never heard of until I met you, which is really interesting. But if you think about it, it's very needed. So before we get into all the stuff you do on an everyday basis at Belhaven, take us back. You're from Fairfax, Virginia, George Mason University for undergrad and grad school, and you did start out doing the regular sports stuff. You did the lacrosse, football, and all that stuff. So tell us all about that and what all that involves.
Yeah. So I went to George Mason. My major was athletic training. I'll say before that, I didn't really know what I wanted to do, even going into senior year of high school. I knew I wanted to do something in the medical field, but I had really no idea. And I ended up finding out that the students could shadow the athletic trainer at my high school. And so I went during 2-a-days for football camp. I went for 2 weeks and shadowed. And I was like, this is what I want to do. This is perfect. And so I ended up staying the rest of the year and shadowing. And so then I went into grad school or into school with an athletic training degree, took a whole bunch of different classes, anatomy and kinesiology, learning different special tests and all that stuff. And then I graduated in 2018 and was certified as an athletic trainer. And then I got licensed in Virginia to practice. And so then after that, I went straight into graduate school to get a master's in kinesiology. And so I did that for 2 years. And while I was in grad school and even from junior year up until I graduated with my first degree, I was working in dance stuff. So I was doing research, I was working with dancers and stuff like that. And then I graduated with my master's in 2020 and was looking for a job and really wanted to do dance stuff. And then this job here at Belhaven came up. And so I ended up moving here. And so I've been here since 2020. But yeah, I've done a whole bunch of different sports. When I was in my undergrad, my first clinical rotation was at a high school. So I did football, basketball, volleyball, all the typical fall sports. My second rotation, I went to Georgetown University and worked with their women's lacrosse team for a semester. And then I went back to a different high school, but it was more geared towards students that were really, what do I want to say? It was like STEM. So they did a lot of science and technology. Well, it was a science and technology school. So, but I did football, the same stuff, football, volleyball, all that stuff. And then in the spring, I went and did my first dance rotation. So I worked with George Mason School of Dance for their spring semester. And then for my senior year, that whole year, I ended up going back to a different high school. So that would be my third high school experience. And since I was a senior, my clinical advisor gave me a lot of room to kind of grow and have my own like autonomy and be able to make decisions and things. And so I worked with every sport: football, volleyball, softball, soccer, all the things. And then I started doing dance stuff. So the body is the same, whether you're a soccer player or a ballet dancer. It's just you move it in different ways.
And that's a great segue, because what we were just looking at is that whether or not you want to be a nurse, whether or not you want to be a doctor, whether or not you want to be an athletic trainer, the science base is extremely important. You can't say I want to get into the medical field, but you don't like science. So talk a little bit about what science classes were needed to get before you even got to the athletic training level.
Yeah, so in college, I had to take anatomy and physiology. So I took a whole year of that. And so anatomy and physiology, we had to learn all of the bones. We had to learn all of the muscles. We had to learn where each muscle attached. So not just like, oh, this is my bicep, but where does the bicep actually attach to, here and down here? And so I had to memorize that because then I would be tested on it. And so I remember having a lab where I just walked in the room and there were different muscles at each station. And I just had to go and say, this is where it originates. This is where it inserts. This is what it does. So we learned all of those things. We also learned about just like at the cell level, like how does the body recover when you get injured? The different types of cells that we have in our digestive system versus our muscular system versus our lungs. Like you have to know all of those things. And so it was a difficult course, but it was really good. So I had to take that. I had to take another anatomy course, but it was functional, what we called it. So in that class, I learned how to be able to feel different muscles and feel like when something feels tight versus when something feels a little bit looser. And so all of what I took from anatomy and physiology, I had to take into that functional anatomy class and be like, okay, now I'm touching a person. So like, what do I do? Like, I can't just go in like really hard, but like there's a science to it. And then we had a pharmacology course. So if you want to be a nurse, a doctor, athletic trainer, physical therapist, you have to know how different medications work. So we had to learn, why do anti-inflammatories work? What is it actually doing in the body? Why do beta blockers work? Like, what's the difference? And so there's a lot of different things that you have to remember. And I think something for me that was helpful is like when you're in the healthcare world, we have people's lives in our hands. So you have to know these types of things. You can't just remember it and be like, oh, I'm gonna forget it, because that one thing that you forgot might actually be the thing that saves somebody's life.
Yeah.
So you always have to keep remembering things and going back. I have books on books in my clinic just so that I can look back at things and be like, oh yeah, that's what that does. So yeah, just it's a lot. But.
Yeah, and then you also mentioned something else. If you're going to be in any type of medical field, especially if you're an athletic trainer, you got to be comfortable you got to be comfortable touching people. You got to be able to see blood. I mean, I'm sure you've seen a lot of it. So, talk a little about you said you have to feel muscles to see the extent of the injury. You have to, if somebody injured if somebody's I'm sure you don't see as much blood in dance, but in your sports experience, I'm sure you've seen blood. People get cut, so you have to care for lacerations. So talk a little bit about what you've seen and what you can expect if you're interested in this.
Yeah, I remember one of my first really big injuries. I wasn't even in college yet. I was in high school as, like shadowing. And we were in athletic training room and someone runs in, they're like, someone just got hurt and like there's blood everywhere. Anyway, someone ended up falling and like cracking part of their head, just like it was like and so there was blood everywhere. And so I'm getting up the blood and like all of this stuff. And so I was like, yeah, this is like, it's a good thing I don't have a queasy stomach because stuff like this just happens. But that was one. I had an injury when I was in college. There was a football player who was dogpiled in a game, and we went, and then he got up and his leg was broken, and so we had to run out there. Thankfully, it didn't like come through the skin or anything, but like when you see a leg that's like not the way it's supposed to look, it's a little different. So yeah, I've seen a couple of different things. So I would say if you get weirded out by touching people, especially feet, like if you want to work with football or you want to work with soccer or basketball, like volleyball, you're going to have to touch people's feet. Track, like it's just a part of, the sport. Even with dance, I mean, I touch feet all the time. So, you can't get queasy with that. Blood is a little hit or miss, depending on where you work. If you work wrestling, get used to it. Wrestlers, bloody noses happen all the time. So you just stick it, clog it up and move on, switch your gloves and keep going. So yeah, I mean, athletic trainers, we see it a lot, but depending on the sport, we might not see it as much. So
yeah, and there's something else we were just looking at. We looked at an athletic trainer with the Cleveland Browns, and what he was saying is that, even though he is an athletic trainer, he has to be able to diagnose for a doctor. He has to be able to go off a physical therapist, a rehab plan, and he has to go off of a pharmacist drug. So there really has to be a lot of knowledge of multiple areas in athletic training. So what are all those areas that you're familiar with?
Yeah. Yeah, we have to be familiar with all those things and we have to be able to communicate with all those different people. So when someone gets injured, sometimes it's just me working with them, but other times I have to go to a doctor and I have to be able to communicate with them, hey, like this is what I think is going on. What do you think? How can we come together so that I can help them better because they're mostly going to be doing rehab with me? Or maybe they went and saw a PT, like I have a student right now. She went and saw a PT over the summer. And so I called the PT multiple times, been like, hey, this is what I'm seeing. What did you see in the summer? What can we do? Like, what did you do that worked so that I can start to do it here? Um, we really have to be able to know how to communicate with different people and not take it personal when like a student wants to go out and get another opinion or something. Like we should be able to work together. I should be able to work with a chiropractor. I should be able to get a script from a PT that like says everything I need to do and be like, great, okay, this is perfect. Like I want the help. Like I think sometimes we want to just do it all ourselves, but I think if we can collaborate better, if we can, just talk through things a little bit better, I think that's really helpful. But we do need, if someone gives me a script and it says, hey, you need to do stem on this setting, you need to do this amount of reps for this thing, like I need to be able to know how to do that. And if I don't, then again, call that person and be like, hey, can you just explain to me like what you did and how did you do it, and this is what I have, like I have limited resources, but this is what I do have, and so what can I do with what I have to be able to get what we need.
Yeah, and that's a good segue too, because we just watched another video where a surgical tech was talking about the importance of soft skills in the medical industry, because being able to communicate with, in your case, dancers, being able to communicate with other professionals is vital, because if there's a breakdown in communication, someone could be seriously injured, someone could not, or they could not rehab an injury correct. So how
Yep.
important is to be able to talk uh, to different people? You can't be scared to communicate.
Right. Yeah, so in one of my classes in school, we had to learn how to spine board somebody. So if you guys have watched football, you know that when like if you've ever seen athletic trainers run out there with the stretcher and like they're holding their head, like we are the ones that kind of we're the directors of that whole scene. Like we get there, we hold their head. Whoever's at the head gets to control everything. And so we can't be scared and say, oh, I don't know what to do. It's like, no, if someone's on the field and you think they have a neck injury, okay, this is what we do. You tell the doctor, hey, you do this, EMS, you do this. We're gonna roll them on 3. You're gonna listen to me, and this is how we're gonna do it. And so we were taught how to do that, and we practice that a lot. Um, but in different situations, yeah, you're going to have to be able to communicate because they can't read your mind. And when students are confused about an injury or they're scared about an injury, you need to be able to say, hey, this is what I think you have, this is how long I think it's going to take. And if they have setbacks, then you need to be able to be honest with them and be like, hey, this isn't looking the way that I want it to look. I think we should go get a second opinion from a doctor. And then even in the doctor's case, like sometimes athletic training is becoming more recognized, but we're not at the point yet. And so sometimes some doctors don't even know what we do.
Wow.
Sometimes they just think we just hand out water bottles. But it's like, no, like I actually did a test, like I did tests, I did an evaluation. This is what I found, and this is what I need you to do. And so being able to advocate for your students and for your faculty and all those types of things. So communication is one of the biggest things, not just as an athletic trainer, but I think as healthcare providers in general that we have to
Yeah,
do.
yeah, because even in a non-athletic setting, if you're providing care for anyone, any breakdown of communication can have catastrophic effects. Now,
Completely.
obviously, most of us, including me, had never heard of dance science. So we don't think of dancers as being athletes, but the stress that they put on their, especially their lower body, has got to be incredible. So um, even though you don't have a dance background, that's something you've had to learn, because even though you said the body is the same, the actions aren't always the same. So
Right.
you've had to become familiar with how these people, these students are stressing their bodies and the possible injuries they could have and how to rehab that. So you're wrapping ankles, you're icing knees, like you said, you're dealing with feet. So what are some of the things that you do on an everyday basis when it comes to dancers as opposed to football players?
Yeah. So I would say in general, in any kind of situation. So I've been a dancer. So I don't I don't do all the styles that they do here, but I have done some things. And so I have a general idea of what they're doing. But and I would say before I go into what I do, I would say in general, if you want to go into a certain sport, so let's say you want to work with volleyball, but you've never played volleyball before, you need to do the research about what types of injuries do they do, what types of movements do they do, because whatever movements they do is going to affect what types of injuries they have. And so what I do here is a lot of times I'll go upstairs and watch class. So I can see how they're starting to move, because if they start coming in to see me with different injuries, then I'm like, what are you guys doing in class? So then I can go watch them in class, and I took a biomechanics course. That's very helpful. But I can watch how they're moving, and I can say, oh, you're not doing that right. So you're going to come see me for a knee problem, or you're going to come see me for a hip problem. Same thing with when they have rehearsals, like we have shows next week. So I try to go to each rehearsal and watch what they're doing in rehearsal, so I can be like, oh, you guys are doing this thing over and over and over again. Your back is going to be really tired. So then that informs me when I give them rehab exercises, or when they come see me for pain. I'm like, oh, I already know why you're not doing this correctly. So most of my day, I come in the morning, do a whole bunch of emails. It's really boring. But the rest of the day, 9 a.m. to 4, I have appointment slots open that my dancers can come in and see me. And it can either be for an injury evaluation, it can be for rehab, or it can be for strength training and prevention. Because again, like you said, we don't see dancers as athletes, but they are. They just move a lot differently than what we're used to seeing, right? Like they're not a wrestler who's down on the ground and in this position, but they just move their hips like all the way up here to their ear, which means that if they're going through an extreme range of motion, there's a different way that they might get injured. And so I think I would just encourage you guys, just because we don't understand something doesn't mean it's not valid, or doesn't mean that it's not important or hard. We just have to put in the time to understand what they actually do. Um, and so I would encourage you with any sport, whether you don't like football, that's fine, but you still need to know, oh, okay, so if they're a lineman and they're coming up and doing this, okay, well, their wrists are probably gonna get a little hurt. Like, you just have to put in the time into learning and understanding it. And when you do that, you start to build trust with your patients, because they're like, oh, they actually kind of care. Like they actually kind of want to learn about what I do. And so that's um, really helpful.
Yeah, and you also made a good point there too, because a lot of people, they see the athletic trainers on the catastrophic injuries, the ones that happen all of a sudden. But you just said they could be in practice, and it could be a gradual injury over time. You could say,
Yeah.
hey, you're not moving your body correctly, you're not landing correctly, or it could be an aggravation of an old injury they had doing something completely different. It could be from a fall at the house, and that's where that's where again the communication comes in, to ask where that could have come from. And you're at the rehearsal to see how they're moving their body, and then that's where you have to have the correct technique in wrapping an ankle, because we've all tried to do it ourselves and we always do it wrong, but there is a science to that as well.
Mm-hmm. Definitely. Yeah. Yeah, I mean, if they rolled their ankle and I pull them more into the way that they rolled their ankle, then they're gonna roll their ankle again, right? So I have to be able to know when I tape their ankle, okay, this is how I'm gonna do it. I would say to the communication piece we talked about. So whenever a dancer gets injured, it's not just now me communicating with the patient. I now have to talk to all of their professors and say, hey, this is what they're allowed to do, this is what they can't do, and stay in communication. Because I think um, a difference between like all the different sports we have here on campus and my dancers is that my dancers get a grade for participating. So they have to dance. Otherwise, they have to withdraw from their class, which means then if they're a senior, that might be a little bit difficult now, because graduation could be affected and all these types of things. So there's a little bit extra pressure or incentive there. It's like, no, I have to figure out how to keep them moving. Whether they can actually do everything or not, that's fine as they're healing, but they have to keep moving because they still have to get a grade. And so that communication piece is so important, because otherwise we're all just going to be like, what the heck is going on?
Yeah, because even though it's not like a professional team where they've paid an athlete a ton of money to play, these dancers have invested a lot of time and money to get to where they are, and they're depending on this for the next step in their career. So there is a lot of high stakes involved, and I think people need to understand that as well. That in a different way, there is a big investment big investment from these dancers. But I do want to get to some of these questions from the students, and these are all ninth graders. Let me see, what's the one I want to start with? Okay, this is a good one. This is Donovan Smith, and he asked, "How do you evaluate an athlete's readiness to play before a competition?"
Good question. So the things that I like to look for, do they have their full range of motion back? So let's say they sprained their ankle or they rolled their ankle. Can they not bring their foot all the way up to where they used to be? For my dancers, they have to like point their foot a lot, right? So if they don't have their full point, well, that's going to be an issue. So I got to look at their range of motion. I got to look at their strength to make sure that they can actually do what's being asked of them in their piece or in their class. So if they can't even hold, like, be on their toes for like 5 seconds, then I know they're not ready to go back out there. And then that also takes in the endurance aspect. So like a piece that they're in could be 5 minutes. If they're exhausted by 2, like, you're not ready to do the whole thing yet. Like, let's progressively get back to where you were, but I'm just not just going to throw you back into it, because then you're going to get injured again.
Yeah. This is London Lott, and she asked, "What was the main inspiration for you to get into this field?"
Great question. Yeah, I think the biggest thing was, like I said, I've been dancing for a long time. And I noticed that there weren't um, athletic trainers or medical professionals to really help dancers. And I'm like, I see a lot of dancers getting injured. Like, I know what we do, I know how difficult it is. I want to be able to help other dancers get better and feel better. And so that was my main inspiration. I was like, they deserve help too. We just don't understand what they do. But just because we don't understand it doesn't mean it's not important. And so I just am one small little drop in the ocean to hopefully just continue to encourage them and help them in their journey while they're here.
Yeah, and it's like we said, the dance science is relatively new, and it's fast growing, and it's good that you're here at the beginning of it, and really get the word out. This is Shania Charleston, and she asked, "Do you ever feel bad if you have to sit someone down on a severe injury?"
Yes, I've had to do that a couple times this semester. It is not fun. There are a lot of tears involved, which makes sense, right? Like, this is their life. This is the thing they've been working towards for years, their whole, teenage time, like high school time, when most of these students started when they were 4, right? Or maybe 3 when they were dancing. And so they've gone all of this time, and now I'm telling them, you're injured, you can't dance. Like, that's a huge blow to their life. And so, yeah, it's not fun at all. I think that, um, it, the way you say it is really important. If I come in, if I get the doctor's note and it says, "Oh, you're done," and I just come and say, "Oh, you're done. Okay, bye. See you later." Like, that's going to hurt them a lot more. And so if I come in instead and say, "Hey, like, I know this is a really terrible situation, but this is not the end of the world. This is right now. This is a semester, but you have such a whole life in front of you." I think one of my sayings is, longevity is the goal. Like, yes, you're in college and you have 4 years of college, but I want you to be able to dance 20 years later. Like, you have a whole life to live. This is one little drop in your bowl of life. Like, let's see that also. But it is really difficult.
I'm
It's
sure.
not fun.
Now, this is Kaylee Luckett. She's one of our cheerleaders here, and she asked, "Where do you see this field going in the next few years?"
Great questions. I love these. Yeah, so I am on a committee for athletic trainers for performing arts, and what we're trying to do is just get more people into performing arts. We're trying to spread the word that this is a really great field to be in. There are people who really need help and deserve help to do the things that they want to do. So I would love to see every collegiate dance program in the US have either a physical therapist or an athletic trainer that provides care to their dancers. Cheer is another one. I would love to see cheer get some praise as well, because you guys do a lot with cheer. And so I would love to see that. On top of what I do, I also do research, dance medicine research. And so in the research that I do, I hope to be able to just shed more light on what dancers go through so that we can start creating resources and tools that better help dancers like get through the things that they're doing, so that they don't get injured as much.
Yeah, and then that's a great point. Cheerleaders are athletes as well, and they also put themselves in potentially dangerous situations with everyday athletic things. So that's a great point. Um, this is Jemiah Carson, and she asked, "What was your most difficult class in college?"
Uh, difficult class. I would say the pharmacology class was pretty hard. Just because there was so much biology involved, like just knowing different pathways of things, like why does Tylenol work different than ibuprofen? There is a reason why they're different. Um, and remembering names and things for different drugs and stuff. Thankfully, I don't work a ton with like I can't give out, drugs or anything, but that was a really hard class.
Yeah, and that also goes back to communication because you got to ask if somebody's allergic to something, because
Oh,
you don't want to
completely.
put something in somebody's body and they're allergic to it, it could kill them.
Completely. Yep. And you got to tell them when they go to the doctor, you need to tell the doctor you're allergic to penicillin or any type of psyllin. Like, yeah, we don't want them dying at all.
Yeah, and I know you obviously don't deal with a whole lot of allergic reactions, but if somebody's in an outdoor sport and they're allergic to a bee, it happens. People are at soccer practice and they're out there near a bee that's at a flower and they sting them. They're allergic to bee stings. Trainers got to know what to do.
Oh yeah, my last year in school, I was at a cross country meet, and long story short, I had probably over 25 to 30 students, runners, who had gotten stung by bees, and they were all coming towards me, and I didn't have any of the information like who was allergic or not, and so me and my preceptor are running around like trying to make sure people aren't dying from allergic reactions. So yeah, I don't see them as much, but I do have people who are allergic to a lot of different things, and so I have to be very aware of
Yeah.
that.
Yeah, that's crazy. Oh man, I can't even imagine. It's the last one. This is one of our other cheerleaders, Quinija Walker, and she asked, "What do you think is the biggest effect on society that athletic training has?"
Wow, biggest effect on society. It's a good question. I think I think athletic trainers are really important because we see the day to day. We see you guys every day. We don't just come in once a week. We don't see you once a month, but I see my dancers every day. I know when they're happy. I know when they're sad. I know when they have gotten really terrible news. And so I think it builds a different type of trust within patients and athletic trainers because we get to know you guys on a different level. Like we know your injuries, whatever, but like I know if you really love the Saints, or know if you really love Hamilton. Like we get to know each other as people versus just an athletic trainer and a student. And so I think we build those relationships, and those relationships last long past when you're at school. But even like we go to your weddings and we see your kids when they're born, and like all of these types of things. And so I think it just brings this different type of, I don't know, love and community and trust, that's a little bit different than other professions.
Yeah, that's awesome. Now, and we're almost out of time, and as always, thank you so much for meeting with us. But
Yeah.
talk about there's a need for females in this field, and there's a need for minorities in this field. So talk about because the field's not going away because, like you said, you want to grow the awareness. But why should young people consider getting into this, especially our young ladies and our minority students?
Yeah, we need you guys. We want you guys. Athletic training is hard, but it's also really rewarding if it's something that you truly enjoy. I think the profession is really starting to grow and advocate for different things, advocating for pay, advocating for just like being recognized in certain avenues. And so, yeah, in my field of dance medicine, there are maybe 4 or 5 Black women athletic trainers. And I think we bring something different because when my Black dancers look at me like, and I'm wearing hair like this, like they get it. Like when we're talking about makeup, like that doesn't seem like a big deal, but how do our Black students do their makeup for stage if they're not taught it anywhere else? And so now I, as a Black woman, can now advocate and say, we need this. And so I would say we have each one of us have different perspectives and different backgrounds that are able to help somebody else. And so I would say if you are a minority and you have felt like people haven't seen you, or you haven't gotten the care that you feel like you needed, let's try and be that for somebody else, so that the next generation coming up doesn't have to go through this thing of like, no one understands me, no one gets it. Like, let's try and be that. And it doesn't just have to be you. Like, let's build a community, let's build a profession where we have so many people who look different than us, but that can help feed into other upcoming people who need someone to be able to look at, somebody that they can trust, and someone that they can just laugh with and cry with, and just, but they get it and they don't have to explain who they are. So yeah, we want you, we need you. It's hard. Healthcare is really hard. I'm not gonna lie about that. But I think if you truly have a love for helping people, and serving people, and just wanting to see people succeed, and having a huge role in that, I would say, come try us out. You know?
Yep. And you've always got a good seat to whatever's going on.
Completely.
Yeah.
Oh, being on the field for a football game, nothing beats it. Nothing beats it.
Yeah, and it's all, you know, and let them know where to find the schedule for the Belhaven dance. You guys got a great program there if anybody's interested in coming to you guys.
Yeah, please come watch. We actually have our fall dance concert is going to be next Friday and Saturday, so November 4th and 5th at 7 p.m. And then we also have it the 11th and 12th. And then we have another, it's called the Immersion Choreographers Concert. That is November 19th and 20th. We always have shows going on here at Belhaven. So yeah, I would check us out on Facebook, Belhaven Dance. We have an Instagram as well. We put like different behind the scenes moments of guest artists and different types of things going on here in the department. So yeah, if you've never seen dance before, I totally suggest coming to watch them and just being amazed at all that they do.
Awesome. Well, again, thank you so much, Victoria Fauntroy,
Yeah.
Belhaven Dance, Belhaven Blazers over there at Belhaven University. Thank you so much for joining us today.
You are very welcome. Thanks for having me.
All right, talk to you soon.